So let's talk about eczema, which is commonly known as dermatitis, which basically means inflammation
Eczema
of the
is broadly
skin.
classified into two large groups, exogenous eczemas and endogenous eczemas. Let us look at endogenous eczema.
There exist so many types of endogenous eczema, but today we are going to look at Lichen simplex chronicus. This is what you will see in a patient presenting with Lichen simplex chronicus. The involved skin is usually scratched or rubbed continually until it gets lichenified, or rather hardened or roughened, and there's usually no prior skin disorder. Emotional tensions can perpetuate the disease. This is the pictorial representation of Lichen simplex chronicus, showing an area which has been scratched over time and therefore has hardened and roughened. Let's look at the clinical features. Usually, there's intense pruritus, which is often out of proportion to the observed skin lesion. Itching occurs in paroxysms of great intensity, and these periods of intense itch and scratch are followed by periods of freedom, setting up an itch-scratch cycle. Now, initially, that scratching tends to give great satisfaction, but furious scratching often leads to soreness and excoriations. The skin becomes red and edematous, and with time becomes scaly, thickened, and may have exaggerated skin markings. With time, pigmentation occurs. This condition is very uncommon in childhood, and the peak incidence is between 30 and 50 years of age. However, it may occur at any age from adolescence. Almost any area may be affected, but the most common sites are those that are conveniently reached. The usual sites include the nape of the neck, the lower legs and ankles, the sides of the neck, the scrotum, the vulva, the scalp, the upper thighs, and the anus, and the extensor surfaces of the arm. How do we manage Lichen simplex chronicus? Treatment involves breaking the scratching habit. 1, by avoiding the scratching. 2, wearing protective clothing to avoid the scratching. And sometimes we do apply plaster of Paris. Medications used include sedative antihistamines like chlorpheniramine and cetirizine, and potent steroids like betamethasone.